The software that we developed, it's called Quit Advisor, MD, actually began as a software program for handheld computers. Currently, our prototype that was developed in our Phase 1 grant related to Quit Advisor is being used throughout the country as part of a national initiative to promote the smoking cessation guidelines that were updated in 2008. Basically, it's an initiative called CEASE, or Continuing Education Aimed at Smoking Elimination, and it's a 9-partner grant, of which UVA is one partner, and we have made 1,000 licenses for Quit Advisor as the web-based tool to be used by physicians throughout the country as they deem applicable in their practices. So we are getting great quality, feedback on the use of this tool and its impact in practices in a non-randomized fashion, but nevertheless great information that will feed into the randomized controlled trial that we'll be conducting with physicians in this Phase 2 trial. Well, what we found in our early pilots was that some physicians used our software a lot, some used it a little, and some didn't use it at all. So in terms of trying to scale it up to a randomized controlled trial, as we're going to be conducting with Quit Advisor in this recently funded grant, we needed to figure out incentives for the physicians to use the software. Initially we thought, hey, we're going to give you this great software and the physicians would just use it. And it worked for some folks, but there really need to be some incentives. Physicians are extremely busy. It takes a lot of effort for them to kind of take time away from clinic and to learn a new piece of software. So we obviously make it as intuitive and as easy to learn as possible, but there has to be some benefit for them to use it. So we are going to be working with the Continuing Medical Education Office here at the University of Virginia, as well as with some of the national specialty boards, the American Academy of Family Physicians and the American Board of Family Medicine, to see how we can apply time used with the tool with patients as continuing medical education credits for time spent on the tool. Quit Advisor helps to address one of the biggest problems that we encounter with patients and their health behaviors. So in this case, it's with smoking. Most of them, if not all, are aware of the dangers of smoking. So the traditional lecture that physicians were taught to give on all of the bad things that smoking can do to a patient is really not all that helpful to patients because they're aware of these things already. We do think that there is some benefit to personalizing these risks, and so that is included in the tool. And so sometimes the patient may not know, for example, that smoking by the parent can lead to increased ear infections in a child or an increased risk of sudden infant death. So we certainly wanted to make sure that those personalization risks are in there, and that is part of the intervention. What Quit Advisor does is it uses motivational interviewing, or teaches physicians how to use motivational interviewing, so that even the patient who isn't ready to quit may start to wonder or start to think about why they aren't ready or why they may be ready and what the reasons are for potentially quitting. And so it's a very patient-centered experience, the interview is, and the counseling associated with motivational interviewing, and it's very different from the traditional lecturing and advising that physicians traditionally have been taught how to do. So it's a very different approach. Patients are very satisfied with the approach because it's not confrontational, it's not argumentative, it's based on their kind of intrinsic ambivalence about their smoking, because most patients have something they like about it, that's why they continue to do it. Many patients also have things that they dislike about it, and highlighting this discrepancy is what has been shown to help patients move towards trying to make a change in their health behavior. We expect that there will be more counseling going on in the intervention group, more quit attempts, higher recommendations being followed, such as prescribing medications and referring patients to toll-free quit lines. And we also ultimately expect that there will be more quit attempts and more successful quit attempts. And that is our hypothesis.